question?
Okay, ma'am, I'm ready.
Okay, so if you read and understood considering it's surgical anesthesia, please tell me what exactly are you looking at?
I'm looking at the base of skull.
Okay. How would you divide the base of the skull?
I divide base of the skull into anterior, middle, and posterior cranial fossa.
Please tell me the boundaries of posterior cranial fossa.
Posterior cranial fossa, there is the anteriorly petrous part of temporal bone, and posteriorly there is occipital bone.
And laterally and superiorly and inferiorly. This is such an incomplete border.
Laterally,
Yes. Quickly. Squamous and mastoid part of temporal bone. Superiorly tentorum cerebelli, and inferiorly there is foramen magnum. Okay, please tell me what are the bones which form the posterior cranial fossa?
posterior cranial fossa is formed by temporal and occipital bone.
Temporal, parietal, and occipital. You can see here in front of you, and you can imagine this is occipital, this is temporal, and then parietal as well. Okay. Please tell me what is 11.
It is foramen magnum, ma'am.
Yes, please. Tell me the structures which pass through it.
Foramen magnum has vertebral arteries, anterior and posterior spinal arteries, and there are spinal root of accessory nerve and lower part of medulla,
Yes,
and there is a apical ligament of dens and tectorial membrane.
very good. All right. If you could identify number 30, please.
Number 30 is
Yes.
this is jugular foramen.
What passes through it?
Jugular foramen anteriorly inferior petrosal sinus. Intermediate are 9, 10, and 11 nerve, and posterior is
9, 10, and 11 in inferior petrosal sinus and internal jugular vein.
an internal jugular vein.
Okay. Right. What is clavis? Clavis.
Clavis
Where
is
which number is?
it is 4.
Very
Is
good.
clavis.
What is it?
It is anterior aspect of foramen magnum. Exactly, and anterior aspect of brainstem actually.
Okay. Right. Can you, okay, this is middle cranial fossa. So if you could identify number 12 here, please.
It's foramen oval.
Yes, what passes through it?
There are 5 aortic ganglion.
You don't move, your voice disappears.
There are 5 structures: aortic ganglion,
Yes.
uh, emissary vein, and one accessory meningeal artery, and a lesser petrosal nerve, and emissary vein.
Oh, okay. And mandibular division of trigeminal.
And mandibular division of trigeminal. Yeah.
All right. Can you identify number 29?
It is therion.
What is pterion?
Therion is a junction point of 4 bones: frontal, temporal, parietal, and sphenoid.
Yes. And what is the clinical significance of pterion?
Yes, middle meningeal artery passes behind this location in a groove and trauma to this area may cause extradural hematoma and tearing of the middle meningeal artery.
Okay. Please identify number 32.
32 is a styloid process.
Yes, of temporal bone, right. Okay, very good. Right, yes, there are more things I could ask you. Going back to the previous image. Yes, you have identified two. Okay, MCF is middle cranial fossa. Right, and what
Yes.
is 44, please?
44 is trigeminal impression.
Okay. There are more things I have to ask you. What is 42, please?
42 is lesser wing of sphenoid.
Okay, please identify number 8 here.
8 is dorsum sella.
Okay, please identify number 1.
This is anterior clinoid process.
Yes, very good. Number 32.
32 is lesser sphenoid vein.
It's
Previously was greater sphenoid vein.
lesser wing of sphenoid bone. Yes,
Yes.
very good. And 13, please.
13 is the superior orbital fissure.
Okay, please identify number 12.
12 is ovale.
Yes. 14, please.
It is foramen spinosum.
37, please.
It would be tegment tympani.
There is, okay, and there is identification of 34, please.
34 would be posterior clinoid process.
Occipital or
No,
optic canal. What is
optic canal.
optic? What does it transmits?
Ophthalmic artery and optic nerve,
All right.
and some sympathetic branches.
Okay. Right. This I have asked you. If you could quickly tell me, what are the dural venous sinuses?
Dural venous sinuses are between the two dural layers that drain the brain parenchyma to the internal jugular vein through the sigmoid sinus.
Yes. How many are they in number, and how many of them are paired, and how many of them are unpaired?
There are, I can just name them. I don't know. I think there would be
Okay.
seven or eight are paired and six, seven are unpaired.
Wait, you should know that 6 are paired
Okay,
and only 4 are unpaired. Now tell me their names, please.
There is paired ones are middle meningeal. There is cavernous sinus, transverse, and sigmoid sinuses, and unpaired ones are sagittal, inferior sagittal, superior sagittal, straight sinus, uh, and sorry, anterior intercavernous, posterior intercavernous, and these are 5 unpaired. And how many of paired did I say?
Okay, please tell me the last question. Benign tumors of the posterior cranial fossa. How many can you name them?
Yes, there is neuromas, facial. Of
Wait,
yes,
benign, only benign.
only benign. Then acoustic neuroma, hemangioblastoma,
Me-
medulloblast,
Medulloblastoma and
ependymoma.
ependymoma. Just 2. Okay, good. Thank you.
Thank you, ma'am.
Did you tell me the significance of pterion?
Yes, ma'am.
Middle meningeal. Okay.
Yes, ma'am.
Right, thanks.
Thank you.
Thank you.